I'm Billy Hollowell. Welcome to the Inside Story. Today I'm welcoming John Brown from the Christian Post to break down a really important story. John, how's it going today?
Good, Billy. Good to be with you.
Well, good to have you. This story is one that I think has crossed some people's radar, but a lot of people aren't aware of what is going on here. We have a doctor down in Texas, Dr. Eithan Haim, who is really at the center of quite a difficult scenario. He is facing potentially 10 years in prison, and we're going to get into why that is. But first, tell us, who is this doctor? What's his background?
Well, Eitan Haim, he's a 34-year-old surgeon who's now in the Dallas area, and he blew the whistle last year on Texas Children's Hospital in Houston. He did his residency there, and he uncovered evidence that the hospital was still performing trans procedures on kids, even though they said they had stopped them. So he leaked those records to journalist Chris Rufo last year, and now he's facing a $250,000 fine and up to 10 years, as you said, in prison if he's convicted.
All right. So obviously a lot of people are going to say, "Wait, what what exactly does all this mean?" So we're going to break the different pieces down. What from the government's point of view, why is he facing 10 years in this massive fine? What are they specifically saying he did that would warrant that sort of potential punishment?
Well, ultimately, the prosecutor slapped him with 4 counts of wrongfully obtaining individually identifiable health information. They're alleging that he wrongfully accessed the records at TCH after his residency was over, and that he intended to cause malicious harm to the hospital. He's adamant that he did nothing wrong, though, but that's what their contention is.
So that's what their contention is. And of course you have, when it comes to records and HIPAA, which we'll get into, there are some complexities there in terms of the law and privacy. When he came forward with his claims and said, this is what is going on, they're still doing this, what were some of the specific things that he said, and why did he do it?
Well, ultimately, back in February 2022, Texas Attorney General Ken Paxton, followed by the governor, Greg Abbott, they issued orders labeling trans procedures for kids as child abuse. And so that was the foundation of what he did. And the hospital came out after that and said that, okay, we're stopping these procedures. But then he discovers that despite their claims, they're still doing them in secret. And so he managed to get into these records and found that they were still doing them. And he actually found one instance where this girl had a hormone blocking device implanted into her a day after they claimed they stopped it. So that's ultimately what he's upset about.
So yeah, and clearly you have a situation here where there is a doctor who feels that something is going on that is not proper, should not be going on. He's sounding the alarm in his view, and you have the government coming in and saying, "Wait, you're guilty of, a HIPAA medical privacy law violation." Can you explain exactly what HIPAA is? What are these violations that the government is alleging?
Yeah, well, HIPAA's a law passed in '96. It basically regulates how medical information is shared. So basically, a doctor is not allowed to share a patient's personal medical information if if it doesn't involve someone who's providing that care. So, the case can be made perhaps that Heim violated that law, but both Heim and Rufo claim that the records that he leaked had no personal identifiable information about patients on them. So that's one argument that you could say that he didn't violate it. But Heim's defense is that regardless, because these procedures were labeled as child abuse in Texas, he was required under mandatory reporting laws to report them. So that's his point of view.
Well, and it's interesting here too because you have a situation where federal versus state is popping up here, right? Where you could have a state law that obviously the federal government has made a decision on gender right now under the Biden administration and how gender is going to be handled and how the trans issue is going to be handled. And a state like Texas has very different rules and regulations around that. I mean, these couldn't be further from apart from one another. You have a federal government that has essentially, from what we know, tried to remove age restrictions, when it comes to transgender procedures. And you have states, again, like Texas, who are restricting those things. So you're really caught here with this doctor in a very interesting situation. Now, some people believe that this isn't really about HIPAA, that he's being unfairly politically targeted over this issue. in your perspective covering this, I know this is a tricky question for a reporter, but is there legitimacy to that claim that he is being unfairly politically targeted?
I think there's definitely a case to be made that he is. The response from the Fed seems to suggest that that's the case, and they seem to have gone out of their way to humiliate him. For instance, two HHS people showed up at his house on the day of his residency graduation. They waited until that day to show up and sort of ruin that day for him. And his wife encouraged him not to speak to them without an attorney. And then it turns out she's also a U.S. assistant attorney, and they start going after her and threatening her. So it does seem that they are trying to make things difficult for him in a very unusual way. And it looks like another example of our justice system being weaponized.
Well, I mean, this has happened. The claims around the Justice Department and the justice system being weaponized. Obviously, this started, and of course, this isn't the very beginning of it, but I think the mainstream sort of big picture look was Donald Trump and what's happened with him. And there are different views on whether or not that's weaponization or it's legitimate and he should be held accountable. But there have been other examples and issues. You have the pro lifers being accused and even found guilty of violating the FACE Act and being locked up as a result of that for blocking clinics. There are similar claims in those cases being made about the Justice Department and what is going on there. This particular case, I think, is going to be a big one for a variety of reasons because of the issues surrounding. Look, he's whistleblowing something that again the state is restricting, and yet the federal government is not. Now, there's also a nurse in Texas who has made some shocking claims about the hospital as well. Talk a little bit about her case because that's an interesting parallel to this.
Right. So Vanessa Sivage, she was a nurse there, and she, as you said, made similar claims about the trans procedures after Haim went public. She went even further and claimed that the hospital was engaging in Medicaid fraud by what she described as cutting corners and getting federal funding for these trans procedures, which is illegal in Texas to do that. So the FBI showed up at her house too. They tried to intimidate her. She managed to take a video of that exchange and she leaked that to Rufo, who just tweeted it out a couple weeks ago.
I mean, Rufo seems to be the centerpiece of getting a lot of this information out, obviously, as time goes on, which is very, very interesting to watch. And this has been sort of his platform. So it's not shocking that the two of them, went to him on this. But from your perspective and where things currently stand, what happens next in this case? What's the next sort of big move that we are to expect?
Well, Haim pleaded not guilty last month. His case is going to go to trial in the coming months. They're going to start selecting the jury on August 16th. Haim has gotten enormous support on his Give Send Go legal defense fund. He's raised almost $1 million, and he's probably going to need all of that. His story is obviously resonating with a lot of people, and I know that he has a lot of people praying for him. So we'll see what happens.
Yeah, and look, we have an election in a couple of months. This could be a situation where you see, a case like this potentially even you would assume maybe even overturned or thrown out, or let's say he's found guilty. Maybe who knows? Who knows where this heads? Do you think there's any chance this case would be wrapped by the time the election comes?
I really don't know. I have a feeling that it's probably going to drag on for quite a while.
Yeah, well, and you're going to have obviously this is a situation where if he's found guilty, he's going to appeal. It is interesting to me that when somebody is coming forward, and I'm not dismissing the claims against him that the government has. I'm asking this question. When somebody comes forward with a claim and they're saying this is happening and the response is, "Well, you violated HIPAA to get this information," without really addressing what is actually happening in the case. A lot of times these things happen and it's an attempt to sort of get people to not focus. It's like the Wizard of Oz, right? Don't focus on the thing going on right in
Mhm.
front of you that he's trying to sound the alarm on. Focus on the case we're trying to make against him. I'm wondering if that could be what's going on here.
I think they're definitely trying to distract from the fact that these trans procedures are going on and that they're destroying kids' lives, and it's being done with the approval of people in power and at various levels. So I definitely think what's going on.
And it's happening at a time, and this is important to note, America seems to be marching full steam ahead despite public pushback, but other countries are turning the tide on this. They're no longer doing gender transitions for children. They're no longer offering some of these services that were being offered to kids. And so the rest of the world, or at least Europe, they seem to be taking a different tact and pulling back. And just before we go here, do you think there's any point where America catches on and says, oh, wait, maybe we should be doing the same thing?
I think you already see that happening, but it's happening at the state level. So I think that could lead to a crisis, as you said earlier, between the states and the federal government, which we've seen that in our history before, and it didn't end very well.
Yeah, that's a great point, actually, that we are seeing, again, Texas and some of the other states make these moves. And, I think we're going to see more of that unfold. And this conversation about living in two different countries, or living really essentially in America in these two different countries, it seems to be more and more accurate as these issues unfold and the states take very, very divergent views on these cases. John, as always, really appreciate you breaking this case all down today.
Sure thing, Billy. Thanks.
Everyone else, make sure you tune in next week for another episode of The Inside Story. We'll see you then.